My name is Julia Fan Lee. I'm co-founder and CEO of Micrographia Bio. We are a spatial proteomics pathways company here in the TechBio ecosystem of London. Delighted to be kicking off this afternoon with two rock stars of our community here on stage to talk about partnering and deals that drive the medicines forward. So I'll pass it off to both David and Chris to give a 30-second introduction of themselves, and we'll dive right in.
So welcome, everyone. Fantastic to see so many people. I'm David Roblin. I'm the Chief Exec of Relation Therapeutics. I'm a physician, scientist, and entrepreneur. Relation Therapeutics' mission is to understand the biology causing human disease, discover transformational medicines, and to become a leader in our sector. We're doing that by integrating two technologies, machine learning, high-performance computing, and high-density biology, the multi-omics biology that we might get to talk about. But we've got an R&D team that really understands what it takes to develop a medicine. And I think that's an important theme that we may come back to talk about. Use cases for new technologies are pretty pivotal. So we do all of that. Our first indication area is osteoporosis, a disease of the bone. We are all becoming osteoporotic, or osteopenic at least. I'm afraid once you're over 21, you've reached your peak bone mass, and it's downhill from there. Some faster than others. So we've also started our programs in fibrosis and osteoarthritis. With our new collaborative partner, GSK, so it's wonderful to have Chris here. And we work in other collaboration with many others, including NVIDIA, who are so important for the high-performance computer that drives our platforms. Our lead investor is here, Jason Pontin from DCVC and Magnetic Ventures, amongst others. And we chose to base ourselves in the Knowledge Quarter. I had a sort of rather pivotal role in the CRIC early on, which is the eastern side of the Knowledge Quarter. I wanted us to be the western side because I'm a man of Wales, if you recognise the accent. And now I find this is further west than us, Mike. So there you go.
Chris.
Yeah, thank you, David. And yeah, standing room only. Wow. Yeah, so I'm here actually standing in for our Chief Scientific Officer. I think today's knees must have packed in, David. So I'm a scientist by background myself, chemist by training, and lead business development in GSK, which is a R&D reporting function, actually. So business development is fundamental to our R&D strategy. Yeah, and I'm really looking forward to the panel. I mean, what no better way? I mean, we try and really unite science and technology, really, to fuel our pipeline of medicines and vaccines, and our jobs are really not done until we get new therapeutics to market. So, yeah.
Great.
Nice to be here.
So I think many of us in the room, myself included, was very excited to see the partnership announced in Q4 between Relation and GSK. Both of you, how do you see the roles of the TechBio movement and pharma partnering to drive new medicines forward?
Shall I start?
Yeah.
I mean, look, there's so many elements to the value chain, right, in R&D, from acquiring data sets, accessing new platforms, translational models, and in my role as well, we actually acquire companies and in-license new therapeutics as well. So yeah, that great intersection of science and technology, and collaboration is just fundamentally key to that. We can't do everything ourselves in pharma. We have to look outside our own four walls, and we want to have great patient impact. And I think the collaboration with Relation and David's team is testament to that. And just one final comment, I think being here in London in the UK, I think Rosie said it in her opening comments, but the UK really does have a competitive advantage here with the vibrant ecosystem we have of academia, biotech, and of course pharma.
Yeah. So I think, we may come back to how the collaboration was born, but I think what we do is, you know, we have the benefit, I think, of starting from with a white piece of paper to start thinking about how you deploy the two technologies that I spoke about, machine learning and high-density biology. And there are levels of interdisciplinary thinking, which few have. And I learned about this actually first at the Crick. Paul Nurse majored a lot on creating interdisciplinarity, which is different from intradisciplinarity. So in relation, we're really trying to drive together disciplines that don't usually talk, and if they do talk, they're usually using different languages. So it's actually quite difficult to do that in a big corporation which has got fantastic processes to drive innovation in the way big companies do. In a small company, we have a blank sheet of paper, so we can innovate right through people, process, projects, and that's been quite important. It means we can move very, very quickly. We can also test quickly, right? So we can deploy potential innovations very quickly and determine whether they're effective. I think what GSK saw in relation was an ability to define which innovations were going to make a difference to R&D, drug discovery, rather than just were interesting in their own right. And that's like an academic versus a applied scientific view. So I think, it's speed of movement, it's levels of integration, and I think that we also displayed a way of thinking about drug discovery, which made it easier for a big company to work with us.
So if we took ourselves from a 30,000-foot announcement view to today, could either of you share an anecdote at the ground level that's been really a highlight of the partnership to date?
Yeah. Shall I start?
You can go. Yeah.
Yeah.
Well,
I wonder if
was
it's
going
the
to say,
same.
I think you may have skipped a question for me, but one thing when we were actually evaluating the opportunity, so prior to signing actually, and we did the due diligence, apart from really falling in love with a team with a great track record that's delivered time and time again, and you gave David's background at the start, it really was the use case for us, and we were absolutely blown away with the hospital network that the relation team had built access to. I was going to keep it clean, David. I was going to say access to samples, but apparently David's got his first knee arrived today.
Yeah.
So, I mean, looking at the root cause biology and the points of interception from a small molecule, large molecule perspective as they unravel new targets, new mechanisms, validate new biology for us, which really at that front end of the R&D process, hopefully will reduce attrition for us so we get more medicines out at the end. But that hospital network, I think for me, was what really struck true. And then you can tell the knee story now.
Yeah, well, if anyone slips on the way out of here and fractures the neck or femur, their hips are likely to end up. You'd obviously have to give consent. Everything is done. We don't sort of just anyway. So the femoral heads come to us, and we've now extended that to the knees with GSK because we're also interested in not just osteoporosis, osteoarthritis. And we're doing something similar with skin for fibrosis. The reason we do this is there are very few data sets that are for purpose. You've often got just like part of the data set, you may have genomics and then some squiffy medical records, phenotypes, or you've got single cell transcriptomics and you're not sure what cells they are and from what patients. So we get all of this lined up by patient. So it's very unique data sets of patients in osteoporosis who've either got osteoporosis or haven't got osteoporosis, they've fractured or they haven't. We isolate the single cells, the relevant single cells, what we call effector cells, bone-building cells like osteoblasts, bone-resorbing cells, osteoclasts, and you get this really rich picture of disease from whole genome to transcripts of specific cells, to the phenotype of specific cells, and to, of course, the clinical phenotype. And I've forgotten what your question was.
It was a highlight of the partnership so far.
Yeah, so there are a number of entrepreneurs in this audience, and this is like one of those lessons of networking. And if you're not on the pitch, you're not playing, right? So it dates back to JP Morgan, the healthcare conference that occurs in just about the second week of January in San Francisco. extraordinary conference, and you meet so many people walking around San Francisco. We were raising money this time last year, and so it was a full octane conference, lots of important conversations, and it was, I think, Tuesday evening at the Yabena Club, and I traditionally get an invite to the GSK reception, and I was thinking, oh gosh, I'm so tired because of the jet lag and everything else, and someone told me, well, look, you just need to go. So I just went, and then had a few glasses of GSK wine, which was lovely. Thank you, Chris. Ended up talking to Tony again, and just bumping into Emma Walmsley. And I had a sort of 20-minute chat with Emma Walmsley about the challenges of getting this level of integration and interdisciplinarity that we were describing, and then also how quick we were moving to establish biobanks with the right data sets. And that conversation actually convinced me we should do a collaboration, because at that time, we were talking to several big farmers, but I think as a board, and one of my board members is sitting here, still not completely convinced that we should collaborate, because our business is about our own proprietary portfolio. But then meeting the GSK guys, and actually subsequent conversations with Kim Branson, with Keivan Kavandi and others, I think they're a group that understand and are trying to deploy machine learning into high-density biology. So in a sense, like, we didn't have any activation energy. It was a good conversation right from the start, as well as a lot of our people knew each other. Not all big pharma are like that, to be honest. I think there's like a big pharma splits into thirds. Some are like GSK that are kind of really working hard and seeing these multi-omic approaches coupled with high-performance computing as being something that can drive innovation. There are probably a third that know it's going to be important but aren't quite in it yet. And I think there are a third that are still sort of waiting really to see what might happen. So we were super glad to pick up. And then it was handed over to Chris's team pretty quickly. Yeah. And there was somewhat of a competitive process. And these guys promised to do it in 6 months, and they did it in 6 months. So it was a really quick deal.
So now we know, anytime we go to an ENT clinic here in London or accident and emergency, our samples may be heading to Relation. So for Chris, you must receive hundreds of inbound pitches every year from TechBio companies. What stands out to you when you're reviewing them for science or operational success?
Yeah, my job is particularly difficult because the signal-to-noise ratio can be pretty bad at times. There's a lot of companies. I think you said the word use case.
Yeah. How many companies do you see in JPM?
Almost 400.
Yeah.
In one conference, 400 companies.
That's a lot of noise.
Yeah. I wasn't personally in all 400 meetings, but and we have the hard work of the follow-up now. But no, I mean, really the use cases. I mean, my piece of advice to people in the room is don't send us a patent. Definitely don't send us a patent in German. That's really not helpful. People do that, by the way. The relationships help, because once you enter into these collaborations, it's like any marriage. It's difficult, and you need to be able to troubleshoot issues. It's two organizations at the end of the day. What stands out is having an aligned vision from day one around the science, what's possible. Also, I would say being realistic as well. I mean, what we want to know is what is the limitation of the technology, where is it up to, what are the gaps you're solving for, and that really helps with a strong debate. Because pharma, when we enter into these partnerships, I don't know if we sent a coach load of people to you, but we do look under the floorboards, behind the curtains. We're going to get to the critical issues at some point or the other. So I think being really candid, really transparent, really helps, and really focusing in on that use case, which for us here in the area of osteoarthritis, fibrotic mechanisms across liver, lung, kidney, is really important for fueling our pipeline.
So for David, there's only one Relation Therapeutics in the world. There's 20 top pharma companies in the world. Can you explain that process as you're thinking about that partnering campaign, and what stands out between the different pharma companies? You mentioned speed. Yeah. What are the other factors that come to you?
Well, I mean, I think I'd concur with what Chris said. So I think it was important to us to work with someone who had a feel for the technology. Some of the conversations we have are really heavy lifting, and my CTO, who's in the front here, I feel like he's giving lectures on how to do this stuff. And that wasn't the case with GSK, and it's not the case with several others. So you've got a level of immediate interest, and then you settle on, okay, so how are these guys determined use cases? So for us, we got a variant of gene mapper, it's class leading, we can take polygenic disease, the variants of polygenic disease, and predict the genes that are regulated differently. Or we've got a lab in the loop, so we can rapidly move through these in an active learning. And that made sense, and it made sense because actually we're R&D people, right? We're trying to solve problems I and the team know to be important in drug discovery. There's a lot of noise out there. There's a lot of really exciting tech papers for biology. Candidly, a lot of them are interesting, but probably don't add much to the drug discovery platform, because you've got the other thing happening here at the same time, right? You've got massive innovation in the laboratory. You can do many more experiments at reduced costs. So you've got these two dynamics. So you need quite an expert team to determine that actually, I could just do that. I could just do a massive perturb-seq and get that information. So one of the things that you could do uniquely with the integration here, so it is about those use cases, both indications and within the R&D process. So I think we'd worked that out pretty clearly, and for obvious reasons I've touched upon, and I think that struck. And then it's about platform fit, right? Of all of the hundreds of ICD diseases, which are the diseases which you could uniquely use this platform to help solve? And I think that's another important conversation, which was easy to have with GSK. So I think those are the sort of two elements I'd say.
If I may just add on that point actually, and this might be a useful piece of advice, in pharma we actually tend to think in disease areas first.
Yeah.
Fundamentally disease areas driven by unmet need and respiratory, immunology, inflammation is one of those. Then lower down in the hierarchy, we're thinking about what modalities and which modality for the right target, and it's that interconnectiveness of that entire value chain, which I think is very important.
Yeah.
And so after the deal is signed, internally, how do you balance driving forward your own programs with the deals and the deliverables you have to send to GSK?
Well, you've got to deliver,
haven't received
right?
the knee yet.
Yeah. 2 knees today. So we've spun that. Thank you for that softball. We've spun up movement to the knee in 2 months, which I think anyone else would struggle to do. And that's because of the relationships that we've got with the London hospitals, with the surgeons, and of course ultimately with the patients, right? Because they've got to allow this their biopsies to be taken. They've got to be generous with the tissues that they provide us. So we had a very clear map of activities in how we deployed our staff. We will be expanding to do this. We'll start our own indication perhaps a little later than we planned. We planned early this year, it'll be later this year, and that's to allow this exciting collaboration to get kicked off at full pace. 2 project teams already working terrifically well, already seeing very novel science, all from human genetics and human single cell data. I should say that. Everything we do is with human genetics, human cells, and human tissues.
Great. And we often get these headlines of when deals are announced, but we sort of sometimes don't hear anything anymore afterwards. What does hitting this deal or this partnership out of the ballpark look like? If we were to really fast forward and say these all the success criteria met, what should we hear from you in the future?
So I would say to that initially, the relationship has really pulled through from day one. So the teams are on the ground are behaving like the patient is at the center of everything we're doing. We're not behaving like we're 2 separate organizations. We're sharing information, ideas, a common goal. So that's obviously near term. Those teams then have to absolutely deliver. And our job, like I said at the start, is not done until we have a medicine actually out of this on market. I know that's a decade away. So I would say nearer term, it is a bona fide flow of validated targets which we prosecute against with our various platform technologies, whether it be small molecules, large molecules, advanced modalities, and be great to see those entering into our pipeline in the mid to longer term.
And then looking forward again in 10 years' time, we know the TechBio ecosystem is rapidly evolving, and so is the AI ecosystem. What do you think what would this deal look like in 10 years' time between TechBio and pharma? What would this deal look like if you signed it in 2035?
Ooh. Maybe I'll answer it in a slightly different way. I mean, look, these collaborations are going to continue, I would say, for large pharma. We can't do this our own. We have to look at innovation outside our own four walls. The UK is as good as any. You mentioned San Francisco, but you also bump into people on the streets in London, David. Mm-hmm. And I think what's possibly changing is the sources of innovation, actually. I think to stay at the forefront in the UK, we need to keep pushing the boundaries. China is emerging as a source of innovation, actually quite rapidly from a therapeutics perspective, and no doubt in the TechBio space as well. But the network we have here, I think, will keep fueling that. And like I said, a not invented here mentality is just not tolerated in GSK. So I think you're going to see more and more of these partnerships.
Well, I mean, from a career perspective and a company perspective and a science perspective, I think predicting more than 2 years ahead is a rather futile path. I hadn't heard of DeepSeek sort of a few weeks ago, let alone DeepSeek R1, and how it's going to transform the ability to innovate, or not, depending on the reviews that I'm reading now. So, you know, the reason I stay in this business is because we have an opportunity to really transform patients. I left medicine because I thought I could do more transformation for patients in the industry, big pharma and then small pharma. That remains absolutely true. And I think what we are seeing is this moment when there are two technologies that, you know, AI will enable high multiomics biology, and multiomic biology will be enabled by AI. So that it just like there's such an important symbiotic relationship here, which is going to drive massive innovation. And we're just beginning to see it. I think there are a number of great companies, obviously Relation, we've got Recursion here as well, and others that are really working hard to do this. And you know, I can tell you that internally we're seeing extraordinary results. We're discovering biology that you would not have discovered in any other way. Less than 0.1% of the genome is actually kind of understood by way of the genes that are important for disease. So there's a massive part of the genome that we just don't know how it contributes to disease. So I think we're going to see massive advantages that from the utility of these technologies.
Great. And for everyone who, whether a scientist or an entrepreneur in the room who's currently negotiating a deal, what is one piece of advice you would give them?
Well, I mean, be in San Francisco in that
London.
Well, it was a rainy January. No, but seriously, network furiously, understand what the partner wants. The partner wants new targets in indications and therapeutic areas they're interested in. And, you know, to the candid nature of it, don't pretend that your technology will address those problems. Come with it worked through with a solution, and hopefully with also evidence. And I think that's what we had, right? So we had evidence from the osteoporosis program that we could show Chris and the team under NDA that said, actually, this is working, and it could make a massive difference. And then, of course, companies like GSK can put it into perspective with what they might do within their own walls.
Yeah, no, absolutely. I would say dream big, but also be realistic of the limitations, like I said. And I think you said the first meeting, and I actually had forgotten, David, that it was in San Francisco 2023. These things take time January 2024.
Yeah.
These things take time, so persevere, really listen to the partner. You can iterate on their feedback as well. It might be that, you get some feedback from a pharma partner or GSK, which is, we need to see this piece of data to then move forward to the next level of discussion. Listen to that, generate that data, come back and continue the dialogue. Don't give up when you're first turned down, I would say as well.
Okay. So to conclude the panel, we'll do a quick lightning round of just two fire questions. What do you think, respectively, is the most misunderstood part of your company from the outside? And what would you like to clarify for the audience?
I'd like to think, like I said, it's a great industry we're in, whether you're in academia, pharma, VCs. We don't have an exit in pharma like a biotech company, which can be acquired or they can IPO. We rely on getting medicines and vaccines to market that generate revenue, which we can then reinvest in the business and innovate time and time again. And the cycles for that take a long time. It can take 10 years, 15 years, 20 years. I still think that's fundamentally not understood at times. And so fundamentally, everything we do, and I like to tell my teams and hold them to account every day, how are you linking what you're doing today to your objectives, and how is it going to impact a patient ultimately at the end of that? And everything we do, quite frankly, is for that goal.
Yeah. I don't wish to be boring, but I even though we're a smaller company by a little way, and I think it's unusual for a tech bio company, which is often tech-driven. We are very patient-driven. So in fact, we've got a term, patient embedding. Can you understand the patient in that single cell, in that tissue, in the assay? So we think really hard about this, and that isn't always the case. I mean, I've been in biotech for over a decade, and having kind of that level of patient centricity really helps you pull things through, and I think probably was evident when GSK looked into us. So I think that's been super important and continues to drive all we do.
Okay, great. And partnerships are announced, but at the end of the day, it comes down to people doing the deals, and that trust and that team bonding between the two partners. There could be people in the audience today who are future customers, collaborators, patients, interactions with GSK or Relation. Could you tell them maybe something that is potentially misunderstood about working with you that you would like to clarify for the audience, so when they meet you, pitch you, work with you, they know how to respond better?
Yeah, I've got an easy one there. I think there's a perception sometimes that pharma just want to suck up everyone's ideas, like competitive intelligence. I can tell you now, we do not have the resources in my team, in the business development team, 400 meetings. We're really actually quite focused. So if you go into a discussion with pharma and they're asking for certain information, whether it be non-confidential information, confidential information under a CDA, it's usually ask them the why behind the why, and why are they asking the question? How does that change your decision making? What does that mean? What does that mean for their next steps based upon what I tell you? So I would say be really trusting actually of the pharma partner and be curious with their curiosity and try and match it.
Thank you.
Well, I mean, I think we're super lean, right? There's a very small team that has to quite quickly determine whether something is worth doing. And, with GPM, I was kind of often, well, there were two of us pitching, normally with groups of 10 or 15 on the other side of the table. So I think that will remain the case. We need to move quickly and maintain a real focus on delivery for patients and the projects that we embark upon.
Great. Well, thank you very much for joining me on this first panel, and look forward to the rest of the afternoon.
Thanks, Julia.